16. Cerebral spinal fluid. Head injury. Underline the word head injury question. Is on page 16 where I left cerebral head injury. What do you monitor head injury patient? I want you to write down ICP. Second thing, write down the word meningitis. Maybe your patient has head injury, open wound, infection goes in there. What is the early sign of meningitis? Knuckle rigidity. And they are saying patient has head injury and patient is having knuckle rigidity. What is the sign of knuckle rigidity? Meningitis. Are we clear? So all your question, head injury. I want you to add another thing. If your patient has head injury, you're monitoring ICP, you're monitoring meningitis, and write down diabetes insipidus. What is in the head here? What is your patient has? Here, pituitary gland. What does the patient has? Polyuria. See how your question has nothing to do with the brain, and they gave you patient has head injury and patient has knuckle rigidity. What are you observing? Infection. What are you observing patient if head injury taken place, the pituitary gland and diabetes insipidus. So you remember. What drug are you going to give for ICP patients are, underline the word, is glucocorticoid at the end, steroids. What is a glucocorticoid? Are your decadron. Decadron is a steroid. What is glucocorticoid does? It reduces what? Inflammation. Are we clear? So what drug do you give them? Glucocorticoid. I want you to also write down, if you have ICP, you give them also what? Write down the word mannitol. What is mannitol? Is to reduce the fluid. And you also give them in glaucoma patients. So what do you give ICP patients are? Diuretics. You reduce fluid. What medication you are giving? Mannitol. What do you need to give for your patient who has ICP is glucocorticoid. Hypothermia. What is hypothermia? Their fever is very high. So what are the two things is high in ICP? Fever and blood pressure. Are we clear? So what do? Give them hypothermia, reducing the fever. And what do you prevent from fever? Seizure. Are we clear? So what do you cut down? Seizure. And you lower the thing. Barbiturates. I want you to write down seizure medication. So what do you give? If they give you, your patient has head injury. And what are you monitoring patient? ICP. What drug are you going to give whenever your patient has ICP? Number one, you can give them mannitol, you can give them steroids, you can give them seizure medication, you can give the drugs lower the temperature. Are we clear? And what room are you going to put them? Patient who has high ICP is quiet room, preventing stimulation. What if you have meningitis, what room are you going to put them? If they say patient has meningitis or patient is having knuckle rigidity, quiet room, dark room, and quiet room. Are we clear? Non-stimulating word. In the Nclex, they use a lot of time non-stimulating. You don't want to stimulate your patient. Are we okay? So you guys have some idea about your patient with cardiac problem. We talked about ICP, we talked about epidural, we talked about craniotomy, we talked about pituitary gland. Are we clear? Now I will move on underneath a little bit respiratory problem. In your respiratory question, flail chest. What is a flail chest? Chest trauma, chest injury. Are we clear? Now goes in the respiratory system. What do you monitor when your patient has respiratory problem? How do they breathe? It says affected site, that means chest goes down, underline inspiration. When you breathe in, your chest goes down. When you breathe out, your chest goes up. And also they use the word paradoxical respiration. I want you to write down the word para, Paradoxical. This is paradoxical. Whenever you see the word paradoxical breathing, means the chest goes in inspiration and chest goes out in expiration. So what does the patient has? Paradoxical breathing. Are we clear? Now also, I want you to underline where it says, so this is a pain. Patient has chest injury, the lungs are damaged. I want you to write down the word there in shock. What is the meaning in shock? Their blood pressure is dropping and their pulse is high and they have respiration and they are not getting any air, and write down the word hypoxia. So your patient has a chest injury, is again, your patient is going in hypoxia and shock. And I want you to write down the word PEEP rest breathing. What do you do when your patient is having a chest injury and patient cannot breathe and they're going in a shock? Any patient, whenever you have respiratory distress and breathing problem, I want you to write down the word PEEP. Mechanical ventilation. Mechanical ventilation means patient cannot breathe its own. And you put them on mechanical ventilation, and mechanical ventilation means P means positive. Write down the word positive and write down the word positive and expiratory pressure. This is a second setting of your mechanical ventilation. So patient has chest injury, your patient is not able to breathe, they're going in a shock and they have hypoxia, and of course they have chest pain. What kind of breathing you will see them? Paradoxical respiration. The chest is going inward in breathing and outward in expiration. What do? Remember, first thing, patient must be on what? Ventilator. What is the setting of ventilator? The word is called PEEP. And I want you, what does PEEP does? How does it work? So your answer would be on PEEP is improving oxygenation. What is PEEP does? It improves oxygenation. How? By opening alveoli. A-L-V-O-E-I-L-E, alveoli. In your lungs, inside in the lungs you have alveoli. What is alveoli are? They are air sac. And this helped to, what happened? They got collapsed. So this machine keeps them open. Are we clear? And what does it help them? To exchange oxygen and carbon dioxide. Are we clear? So how do you get oxygen and carbon dioxide exchange takes place where in your lungs? Alveoli. So what happened when your lungs are damaged? They have been collapsed. So what do you do for your patient are, number one, put them on mechanical ventilator, your answer. And what setting do you put it in? The PEEP. What is PEEP is positive and expiratory pressure. What does it do? It opens up the alveoli and keep them open to help them to exchange the oxygen. Are we clear? And also your bed, head of the bed should be up. Elevate the Fowler's position. Give them bed rest, Fowler's position, and give them oxygen, and you're giving them is ventilator. Are we clear? Pain medication is important. Are we okay? So what do you do when your patient has flail chest? Your question is, what is patient is having a problem here? When they're breathing in, the chest goes in. When they're breathing out, the chest goes out. Sign of flail chest. And what is another word I said? The patient has what? On the patient would be having a problem in breathing. And now what do you do for your patient who's having a breathing problem is you give them is the ventilator. What setting do you put them here? In PEEP. Are we okay? So we talked about your patient with the flared chest. Second is sucking wound and sucking open pneumothorax. What is pneumothorax word? Collapse of the lung. How do you get collapse of the lung? You guys underline the word is sucking wound. Sucking wound means there is a wound and that is open wound and patient has collapse. So chest injury, open wound, air goes in and lungs get collapsed. So how do you get is pneumothorax by two? Number one, open chest injury is called open sucking wound. Sucking sound with respiration, underline the word, sign of pneumothorax are decreased breath sound. There is no lung sound. Are we clear? You can't hear. And also write down tracheal deviation. Your trachea moves on the other side. That's an open pneumothorax. Second thing you will go is pneumothorax and is called tension pneumothorax. Underline the word tension. Write down another word is called tension. So there are two kinds of pneumothorax. Tension pneumothorax comes from where? I want you guys to write down tension pneumothorax comes from when your patient is on ventilator. A lot of time inside your lungs get collapsed when you are too long on ventilator. Are we clear? So you can go on that. And same side effect on the patients with pneumothorax. You can't hear lung sound. They may have cough. They're going in a shock. Now those are your collapse of the lung. How do you treat collapse of the lung? Chest tube. Write down the word chest tube. You're draining the fluid and you're putting the chest tube. Implementation. In implementation, underline the word monitor for shock. Oxygen, thoracosynthesis. Maybe you're removing fluid. And maybe chest tube. Underline that goes with your collapse of the lung. So for the collapse of the lung, how do you treat them? Maybe thoracosynthesis, you're removing fluid. And what else you're removing here? Maybe through the chest tube. I want you guys to write down another problem in the lungs. Pleurisy. What is the word is pleurisy there? When they say the word, now we are a little bit on lungs and we all know alveoli word. We all need to know pleurisy. When they're saying pleurisy is inflammation. Pleurisy. When they give you pleurisy, pleurisy is inflammation. And what inflammation here? The layer of the lungs. What are the lungs layer are? Parietal and visceral layer. Are we clear? Parietal and visceral. And there is inflammation. So what is the sign of pleurisy is called pleural friction rub. So write down pleural friction rub. Rub it, pleural friction rub. So in which patient do you hear pleural friction rub? In pleurisy. What is pleurisy? There is no fluid, but there is, the word is inflammation. So they will have chest pain. You hear the rubbing sound. Maybe they have problem in breathing and you treat them as respiratory problem. Are we clear? So what is pleurisy is? Inflammation. And what do you hear in the lung is the rubbing sound. I want you to write down the word empyema. What is the word empyema? Is pus. And where is the pus? In the pleural space. Pleural space, you have the pus. Are we clear? So where is the pus? Pleural space. So what does it cause? Infection. Are we clear? And they have fever, they have pain, and they also have what? Infection. Pleurisy. And what do you do for your patient? Maybe antibiotic you give them. And removing the pus. Thoracosynthesis. So where do you do thoracosynthesis? In the lungs. And so I want you guys to know the wording. Flared chest word, pneumothorax word, pleurisy word, and also empyema. When they're saying Pleural effusion, write down the other word. Pleural effusion means the fluid. Are we clear? Pleural effusion means the fluid is, and where? In the same, and where? In pleural space. Are we clear? So what is your lungs are covered by layer, and what is inside that layer you call the pleural space. Are we clear? So everyone should know when you have a lung problem, there may be a question, flail chest. Pneumothorax means collapse of the lung. They can be collapsed when air goes from outside, that's an open. Tension pneumothorax inside, for longer your patients are using is your ventilator can lead to is tension pneumothorax. Are we clear? How do you treat them? By having drainage and drain them the fluid. Everyone is okay, empyema word, everyone is okay, pleural effusion word, and friction. What do you assess for your patient in lung problem? What do you assess your patient in lungs problem? Lung sound, right? Are you hearing the lung sound? Yes. And what do you hear when you have fluids? Gurgling sounds, right? What do you hear? Is more the sound you can hear, and patient has a lot of fluid. Now, what is the best position when your patient has a lung problem? Fowler's position. You want them to breathe, and you are giving them oxygen. I will be talking about other disease as they come, COPD, you should know, and pneumonia. Are we clear? Now, so we covered on this page some ICP question, we covered lung problem, and I covered earlier in the, before that, what did I cover earlier? Pulmonary embolism. Everyone remember the word pulmonary embolism? We talked about it, and now we talked about this. Now let's move on. Cullen sign and Turner sign. Where do you see Cullen and Turner sign? Where do we see that? Pancreatitis. Very good. And what is pancreatitis means? Patient is bleeding. Are we clear? Where is Cullen sign? Underline umbilicus area. Ecchymosis. They have like a bruising. And this comes in exam. I want everyone to know Cullen sign in pancreatitis. Turner sign is also ecchymosis where? Flank area. I want you guys write down a little bit pancreatitis so you will remember few things in GI when you have pancreatitis. Number one, your pancreas is in the left side. And so pain is in the left and goes in the back. And patient feel comfortable in fetal position. So patient says, when I'm laying like this fetal position, my pain gets better. That means patient has what problem? Is pancreatitis. Are we okay? So pancreatitis patient says, when I go in my back, recumbent position, my pain gets worse. Recumbent makes it worse. That means what does the patient has? Pancreatitis. Are we clear? What is the problem with pancreatitis patient are? Digestion of fat. Everyone remember. What is your pancreas is producing? Insulin. Are you going to monitor for sugar? Yes, because they are producing insulin. Number 5 is so sugar, digestion of fat. So your diet, always remember you cut down fat. And also, what is the problem patient has here is digestion of fat and monitor for hyperglycemia. Next is their bleeding. What is in bleeding? You already have in your notes Cullen sign and Turner sign. Sixth thing you remember, they have low calcium and they can go into tetany or twitching of muscle. Because the pancreas is right here, now the problem is in the pain. So remember, you're teaching in them cough, deep breathing exercise. Now we are on the same package in Dilantin, and I'm on page number 16. And on page number 16, Cullen and Turner sign. So Cullen and Turner sign means patient is bleeding. So I'm covering a lot of things about pancreatitis. And I said, where is the pain on pancreas? We all should know on where it says page number 16. And on there, you guys have Cullen sign and Turner sign. And on there, write down the word is bleeding. And where are they bleeding? Is in the stomach area. They're bleeding all over. So every question, prevent them from bleeding. Remember, if you're giving injection and apply the pressure. So make sure we all know, number one, they have a pain in the left side, upper quadrant. Are we clear? And pain goes in the back, in pancreas, because where is your pancreas is on the left side. And second thing, I said, patient says, if I lay on fetal position, I feel better. But if I lay in recumbent, I feel get worse. Why? Because it's stretching and it caused the pain. So what position do you patient stays in? Fetal position. Second thing I want you to remember, next thing is cut down the diet. What diet do you cut down here? Fat. And also they're bleeding. And monitor for sugar because your pancreas is producing sugar. What do you monitor? Low calcium. Pain is because of the pain, they can get pneumonia. Your question is, what do you teach your patient with pancreatitis? Cough and deep breathing exercise. Number 8, I want you to write down the word jaundice because it's liver and pancreas, they can be in jaundice. Number 9, pain medication, you go for Demerol for pancreatitis patients. Are we clear? So what medication do you give them? Is pancreatitis, page number 16. You got it? And we are talking about is the Cullen sign and Turner sign. They're bleeding. And write down pancreas is producing insulin. And what else pancreas is producing? Pancreatic enzyme. What is your pancreatic enzyme? Lipase and amylase. And they will be high. So what do you do when your patient comes in with pancreatitis? Everyone remember, Cullen sign, Turner sign is important. They're bleeding, they have low calcium, they can go in jaundice, cough and deep breathing exercise. See the question they give you, maybe one question. Patient, what position would be good for your patient? They may want to lay in what position? Fetal position. What do you teach them? Cough, deep breathing exercise. Why? Because they can develop what? Pneumonia. Their lungs are not open. One question. Cullen sign, where do you see them? Pancreatitis. Turner sign, where do you see them? Pancreatitis. They are risk for bleeding. I want you to write down on the side they're low calcium, pancreatitis. Maybe calcium gluconate, doctor ordered. Why doctor ordered calcium gluconate? To prevent them from tetany. Are we clear? What diet are you going to give them? Low fat diet. As soon as your patient comes in, write down the word NPO. Maybe you can give them TPN. Are we clear? IV, but give them NPO because pain gets worse. And also with the food, when you start, remember the word pancreatic enzyme. When do you give pancreatic enzyme? With the food. Again, what fat-soluble vitamin are you going to give them? Vitamin A, D, E, K. This is whole picture of your pancreatitis. Are we clear? Now, if you remember, question can be Cullen sign, Turner sign, calcium question, jaundice. What happened in jaundice? The color is pale, their eyes. And what do you remember in jaundice? The urine color changes. And also when you have jaundice, the problem in what? Itching. Are we clear? Because those bile thing, they cause a lot of itching. So everyone, jaundice, Cullen sign and Turner sign. The next is you guys have balance sign. What is a balance sign? Is over the spleen plus sign. That means you have sign of rupture, pain. And where is the pain? On the left side of the abdomen and goes to the shoulder. That means the spleen might have been ruptured. Are we clear? What is spleen does? What does the spleen do? protect us from infection. Are we clear? So if anybody has a spleen problem, splenectomy, you got to give immunization. No live immunization, but yes, you give them to prevent infection. Are we clear? And splenectomy patients is you monitor for infection, and spleen is in the left side, and the pain is on the left side, is sign of rupture of spleen. What is enlargement of the spleen is called? I want you to write down splenomegaly. Which patient do you have splenomegaly? Right side heart failure. And is whenever you have a side, and also liver cirrhosis. Both patient, heart failure, CHF. What side of CHF? Right side. And you have splenomegaly. Why? Because your patient has ascites. Always remember the word ascites means the fluid. Where is the fluid? In the stomach. And whenever your stomach is filled up more fluid, its effect on what? Splenomegaly. What is the word splenomegaly? Is enlargement of the, see, you got to connect it. Spleen question, here we are saying balance sign, but if they say the spleen rupture, that means your patient is, or splenectomy, patient is risk for infection. Sign of rupture of the spleen, the pain is in the left upper quadrant, and patient has splenomegaly. In which patient? When you have ascites. Which patient do you have ascites? And liver cirrhosis, and also for your right side heart failure. Are we clear? Now I will move on. Shock. We all know shock. And why do we get shock? Now you will have underneath, you have hypovolemic shock. What does hypovolemic shock mean? You lose fluid. Dehydration. Which patient do you have dehydration or hypovolemia? Bleeding, shifting of fluid, one patient. And so you have intravascular volume is decreased. What is hypovolemia? Your blood volume is decreased. Are we clear? And what is hypovolemia? Either you are vomiting, diarrhea, maybe you lost blood. Are we clear? That can lead to hypovolemic shock. Cardiogenic shock means you're decreasing cardiac output. What is a cardiac output is? What is a cardiac output means? Cardiac. What is heart does? Pump. What is output means? Cardiac is throwing what? The blood. So what happened when your heart is not pumping? What happened? You're not pumping the blood. So what are you decreasing here? Blood volume. And which patient do you have low cardiac output? Maybe when you have what? CHF. When you have MI, your cardiac output is decreasing. Are we clear? So what is which patient? Especially when you have MI. Your heart is bad. Your heart is not pumping the blood. And when they're saying patient cardiac output is decreased, means the blood volume. Are we clear? Third one is problem with the blood flow to the cells. So I will tell you, shock can be cardiogenic shock, hypovolemic shock. Where do you see shock? In respiratory, pulmonary embolism. So write down respiratory. When your patient is having burn, you are also seeing your patient is in shock. Psychogenic shock. Psycho means mental problem. Severe depression can lead you into shock. So shock is affecting your body. Your body is not meeting the requirement. You're going into shock. So there are many shocks. If they give you the word septic, what does septic means? Bad infection. Can your patient go in a shock? Yes. If your patient is having sepsis all over, bad infection, your heart cannot take care of that. And you're going. So remember, not only shock means you lose fluid. You can go in a cardiogenic, you can go in a respiratory, you can go in renal failure, you can go in your septic shock, you can go in psycho. So the meaning is shock. Let's go vital sign. On the top, it says sign and symptom. What is shock, sign and symptom? First thing I will say hypotension, underline that, tachycardia, tachypnea, and low urine output and cyanosis. That means your patient need oxygenation, right? Your patient need fluids. And which patient are you going to monitor? I will write down near shock, write down the word dehydration. If they are dehydrated, they're going into shock. Are we clear? And also when you're vomiting, your diarrhea, heat stroke question, pay attention. You're monitoring for shock. What is shock is low blood pressure, pulse is high, respiration. What are you monitoring in shock? Your patients are, remember, their dehydration, pulse volume. Always remember, pulse capillary refill. Everyone write down on the side. In your question with shock, you're looking for the pulse, you're looking for is your cardiac, and you're maintaining. What position do you put your patient when they have shock? What position do we put them in? Is Trendelenburg position. What position you are putting? Trendelenburg. You are putting the modified, the leg is up, head is a little low, and modified Trendelenburg position. Are you going to replace the fluid? Yes, because they will need. And what do you monitor when your patient is in shock? You need to give the fluid. Next page, we will move on. Page 17, CVP line. What is CVP line? Central venous pressure. Write down the word central venous pressure. So everyone, CVP line, central venous pressure. What do you monitor? I want you to write down the word blood volume. What are you monitoring? Blood volume or fluid volume. Are we clear? What is in the blood? Our body fluid. Are we clear? So they're asking you CVP line. What is a normal CVP line? Is if it is less than 3, that means dehydration. They need more fluid. Are we clear? So less than 3 means is what? You increase fluid. The fluid is not enough. If it is 11, that means they have more fluid. Both are not good. 3 to 11 is good. Less than 3, more than 3, there is a problem. Are we clear? And where do they put the catheter? They put the catheter in the heart. Are we clear? Write down the word right atrium. Where do they put the, inside the heart is the right atrium. Now, I want you, we guys just finished ICP before that, and I'm going to cover that, is CVP line. Everyone is okay, CVP line? Everyone is all right to know the Cullen sign and the Turner sign? Pancreatitis, I covered completely, so make sure you guys will be aware of that. Now, let's see ICP question. So fluid volume, I already said, and where do you put the catheter? And they check the fluid, they put the catheter in the right atrium. Now, next is sign of ICP. We already said level of consciousness. Glasgow Coma Scale. What are you assessing? Which patient are you going to use for glaucoma? Is who are in coma, and write down unresponsive. What is unresponsive? They're not responding. So they are saying patient is unresponsive and they're not responding. What scale you check? Glasgow coma. What is a normal scale? Should be 15. 1 to 15, remember, but below 8 is positive, your patient is in coma. What do you monitor? Eyes, verbal, and motor. So I want everyone. Below 8 means is not good. Your patient who was not responding for 2 weeks, and today you go and you're turning, and patient moves his hand. What does it mean, moving hand? They're responding what? Motor. And remember, write down the word responding to painful stimuli. So you document. Now, when was below 8 means is bad. When your patient is getting better, you're going to document and your scale is getting better. So if your patient opens his eyes and patient moves his arm, they're getting better. So now your scale will not be 6 and 7, but maybe 9 or 10 is going up. Are we clear? So your questions doesn't come in exam, what is Glasgow Coma scale? They give you the question. Your patient is not responding. How are you going to assess Glasgow Coma scale? By checking their eyes, see if they can talk, if they can feel. And when they start feeling, your scale, you go and go up. Are we clear? That is in your head injury patient. Number 2, confusion, restless, pupillary changes. Write down the word constrict the pupil. When you bring the light, what is normal? They constrict. If they are dilated, that means it's not good. They are not responding. So write down the word normally, they constrict. If they are not normal, they are dilated. Are we clear? So what is it? They are dilated. So that means it's not good. Underline the word pulse changes, widening pulse pressure. I want you guys to remember their vital sign. What happened to their vital sign? Increasing the blood pressure, increasing systolic and decreasing diastolic. Are we clear? So what is the sign of your patient with ICP? The blood pressure goes up. Which one goes up? Systolic. Which one goes down? Diastolic. Then you will say increasing pulse, increasing respiration. Decreasing pulse, not increasing, decreasing pulse and decreasing respiration. And this word is called, I want you to write down, Cushing triad. What is a Cushing triad? Increasing pulse and increasing blood pressure and decreasing pulse. When your systolic pressure goes up and diastolic, it's called widening pulse pressure. Widening pulse pressure. Everyone remember, whenever they give you widening pulse pressure, increasing systolic, that's your ICP. What does Cushing triad word mean? It doesn't go Cushing disease. I want you to write down Cushing triad, T-R-I-A-D. What is Cushing triad? Your blood pressure goes up, pulse goes down, respiration goes down, and Cushing triad comes in where? In ICP. Where do you see widening pressure? Because your systolic goes up and diastolic goes down. That's your widening pulse pressure. Are we okay? Next is, I want you guys add there vomiting. Whenever your ICP is up, I want you to add sign and symptom, vomiting, headache, patient complain headache and vomiting, and also I want you to write down decorticate and decerebrate. What is decerebrate? The body, they become stiff. Decorticate, the body goes like this, and their legs and they're stiff. Decerebrate, their arms are on that side and they become stiff. And the other word is called postural changes. Postural changes. Are we okay? Decorticate and decerebrate. Then I want you to write down the word positive Babinski reflex. Babinski reflex. So if you have positive Babinski reflex, what does it mean? The patient ICP is up. When does the Babinski reflex disappear? In 1 year of age. Now, so Babinski reflex, decorticate, decerebrate, Cushing triad, and widening pulse pressure. Everyone is okay. These are the way you remember your ICP. What do you do first thing? Monitor vital sign, monitor Glasgow Coma scale. Underline the word elevate. If ICP is high, write down the word elevate the head and write down semi-Fowler's. No more than 45 degree. Avoid neck flexion. Don't touch the neck. Don't touch the leg. And environment stimuli. cut down the noise, cut down the light. Why? Right down to prevent seizure. ICP patients are going into seizure. Underline the word constipation, Valsalva. When they have constipation, what happens? Their blood pressure and ICP will go up. Next is restrict fluid. Why? Because they have cerebral edema, water intoxication. So what do you cut down here? Fluid. And you give them steroids and you give them diuretics, and write down the word mannitol. And write down the one seizure medication. So what are the medications do you give them? Diuretics, mannitol, steroids, and the other medication. So everyone is okay. What are the patients you're doing in ICP? So everyone is okay. ICP we learned, craniotomy we learned earlier, and also I'm going to go in seizure. So if you move on seizure, so what is the main thing you remember? You don't give them more. Also, I want you to write down, don't give morphine for ICP. Why? Because their respiration is very low. What is low here? Respiration. Are we okay? All right, ICP. I think let's take a quick break. And if anybody is leaving, I know some of you, make sure you sign up.